Male yeast infection, symptoms and tests. Male yeast infection is a topic that is not discussed widely. Too frequently, information focuses on vaginal Candida infections and fails to address the fact that males can experience penile yeast infection as well as yeast infections on other parts of the male genitals. When a man gets a Candida infection, he may experience no symptoms at all, but often there are symptoms which may not cause the male to think that the cause is yeast at all. The symptoms may or may not involve the penis or genital area. Symptoms of male yeast infection involving penis and genitals. The major symptoms involving the male genitalia can be the same as symptoms which can indicate a much more serious sexually transmitted disease such as syphilis. However, the simple test provided at the end of this article can help determine if yeast is the culprit. The symptoms are: 1. Gland, the head of the penis, may become red and inflamed. 2. Urination may be slightly painful. This symptom usually do not cause the severe pain associated with more serious STDs but can be annoying. This symptom can also indicate a urinary tract infection. 3. Jock itch may develop in the genital area. 4. The male may experience sexual dysfunction not normally experienced. Symptoms of male yeast infection not involving genitals. Here we will continue the list of symptoms, but focus on symptoms and signs which do not involve the genitals, often causing the man to fail to identify the source of the problem. 6. Constipation may occur. 7. Bad breath may appear even though good oral hygiene is practiced. 8. Bloating due to yeast bacteria overgrowth in the digestive tract may appear. 9. Frequent intestinal gas is another indication of the yeast imbalance. 10. Diarrhea may be a sign of infection. 14. Abnormal fatigue without unusual levels of activity may signal an infection. 15. Lack of energy in a male who is normally energetic can be a sign of a yeast outbreak. Memory loss is sometimes a symptom. Unusually dry, flaky skin which is itchy can indicate yeast growth. Athlete foot outbreaks, caused by similar bacteria, can be indicative of a male yeast infection. 19. Sudden onset of prostate-like problems such as frequent urination urges may be present. 20. An unusual craving for sweets or carbohydrates because the yeast bacteria want to be fed. Simple test for male Candida infections. This is a very simple, easy-to-perform test to help a man determine if the signs and symptoms he may be experiencing are in fact caused by a yeast infection. To prepare for the test, simply place a glass of water next to the bed before retiring for the night. Upon awakening, before getting out of bed, spit into the glass of water 2 times. During the next 15 minutes, watch the saliva in the water carefully. If the saliva dissipates into the water, there is most likely no infection. But, if the saliva becomes cloudy, stringy, sinks to the bottom of the glass, or takes on an appearance of spider webs, there is most likely a male Candida infection present in the man's body. The appearance of these saliva indications is very noticeable, so a man with a yeast infection will have no difficulty recognizing the signs. Do not worry that the signals may be unclear. Usually, within the first 5 minutes, it will be very clear whether indicators of yeast infection are present.